Hi everyone, I'm Susan Birch and welcome to another A Health Detective podcast. And today I have Dr Louise Phillips from Brisbane. Dr Phillips, I think I'll just call you Louise if that's
Yes,
okay.
absolutely.
So Louise has been a practicing GP for nearly 20 years and she has developed a very unique system for doctors to learn about how to prescribe low carb. She is a senior lecturer at Brisbane, at the University, Queensland University. So she teaches medical students. She is also supervises registrars in her own practice. So it's really exciting to hear of a doctor having this kind of influence on the new people, the new graduates coming through. And this is going to make such a tremendous difference to patients' health and getting the word out there that we can do something about things like type 2 diabetes and cardiovascular disease and metabolic syndrome and all those other things that come along with it, like fatigue and brain fog and just lack of motivation. So, Louise, thanks so much for coming. I'm really excited to have you here and really excited to share your message with everybody.
Well, thanks so much for having me today. I really appreciate you having me on your show and looking forward to talking to you.
Well, let's start by just talking. Oh, how noisy is my bird at that background?
It's not too noisy.
I've been teaching him how to sing. Not being overly musical at the moment. Okay, well, let's start by, do you want to talk about how you got into low carb? You told me it's been, about 3 years? And yeah, how you discovered it and why you think this is so important.
Yes, so I discovered it about 9 months into the COVID pandemic when I'd been working in masks and it was a very stressful time for practitioners and I think for everyone everywhere. And I'd always maintained my weight by sort of being very careful with what I ate because I knew that if I ever ate more than that, I would gain weight. And then through COVID, just through some very small amounts of extra carbs in the tea room, a chocolate here, a little thin slice of cake there, I was sort of 4 kilos up 9 months into the pandemic. And I just couldn't bear the thought of dieting to try to lose the weight. And I heard a podcast with Dr. Peter Bruckner, who's an Australian
Yes.
doctor who's very big in this space, and he was talking about reducing your carbs. And so I thought, well, I'll try that. And so I reduced my carbs, and 4 weeks later, I'd lost 4 kilos. I wasn't hungry for the first time in my life. Like within 2 days, I wasn't starving all the time. And I just felt great. And so I looked into that a little bit further. And I've got a very strong family history of metabolic dysfunction. So my mum has type 2 diabetes, had a grandmother with it as well. My sister has type 2 diabetes. My dad was what we call a tofi, so he was thin on the outside and fat on the inside. And I'm Chinese, and I was born at a massive 5.45 kilos, so I was 11 pound 15, and that fact that I was such a big baby increased my risk of diabetes sixfold just there. So I was really keen to reduce my risk of diabetes. And I just started to read books and listen to podcasts and watch YouTube. And then I discovered the Nutrition Network, which had some organized courses. And then I've undertaken their certification program, which was the hardest program I've ever done. It was harder than medical school training and harder than GP training. And I just became I think I've become very knowledgeable about the field. And the problem then is how do you tell patients about it in a very succinct way when you're working as a busy GP in 15-minute appointments and half-hour appointments, you can have those as well. And you're also trying to teach other doctors about it when everyone's a bit burnt out and everyone's a bit tired already. And to prescribe nutrition on top of that is a difficult task. So I've sort of set about creating programs which help GPs and other health professionals to prescribe what is in essence very simple advice in short spaces of time, backed up by diagrams and handouts and resources for them, And then I'm also in the process of now developing a longer course, which is being released on the 13th of October for doctors who want to learn about it in depth but also succinctly, and to look at case studies and actually look at real pathology of how it comes in and what things they need to look out for and how to interpret blood results, etc.
Well, you sent me a copy of your program, the one that's been released so far, and I had a look at that, and I thought it was excellent. You have such simple explanations, and I can see how it would be so useful, particularly to new practitioners or practitioners new to the low carb space, and that's GPs, but that's also health coaches and nutritionists and even dietitians who are new to the low carb space. So I think that there's probably a huge market out there for your program. You know, doctors get a lot of flack, and I'm one of the people who actually give doctors a lot of flack.
Fair enough.
I'll put that out there up front.
Yep.
Because I get really frustrated. You know, I get frustrated that they don't understand the labs. You know, I'm like, how can you not understand the labs? I get frustrated that they just dismiss low carb and the influence of nutrition and health and well-being. And so my question, do you want to just explain a little bit from a GP's perspective? Like, tell us a little bit about what it's like to be a GP working in a practice. You've talked about the time restraints. You've talked about some of the other challenges.
Yeah.
So tell us what happens to them and why patients might walk out feeling frustrated and like nobody's really listening to me.
Yes. I think it starts very early on. So medical school training, you just don't get taught anything about nutrition. In fact, I can't even remember a single lecture that was specifically about diet. It sort of gets a little bit woven into gastrointestinal topics, perhaps, but that's about it. And then once you leave medical school, postgraduate training is very much done in an apprentice style. So you learn off your colleagues and what they do, and what they do is generally not prescribe advice. They prescribe, or not prescribe nutrition, they prescribe pills generally. And then after that, you're working in an environment where guidelines are influenced by pharmaceutical companies. Research is influenced by pharmaceutical companies, so they control 80% of what trials go on, and then what gets published, and then what gets published, what's in the abstract is a very poor representation of what the data actually shows in the article if you read the whole article. And then you're looking at GPs. So in general practice, you never know what's going to walk in the door. You're dealing with every single age group from babies to elderly people, and you're dealing with them in between 10 and 15 minutes. And people often come in with 2 or 4 problems that they want to try to get done in that 15 minutes, which isn't possible to do that safely a lot of the time. And then they're often already unwell. So they might be depressed. They might have a lot of conditions that you would like to work on with them, but that's not the condition that they think that they need help with. And so it's very challenging from a time point of view. And then you're working in an environment where you could be sued by anyone. You could be reported to the medical board in an instant, because now in Australia, anyone can make reports virtually directly to APRA and then get investigated. And then colleagues can frown on what you do if you are prescribing nutrition. And then how do you give advice about that takes into account a person's individual history, their individual circumstances, whether they're a single mum or an elderly person with nutritional problems already, or they might have celiac disease, etc. So it's very challenging to give individualized advice, let alone helpful advice that goes against what everyone else in the world is telling them to eat, because the food pyramid or versions of it is what the guidelines say. And if you're going against the grain, you want to make sure that you're backed up by some evidence, and then you've got to have a way of doing it efficiently. So it's challenging.
Yeah. And I talked to Dr. Avi Charlton a little while ago. I'm sure you
Yes,
know
I know.
Avi.
Yes. Yep.
Yeah. And she's doing wonderful work as well. And, she talked about, well, because one of my questions to her was about the blood tests, like, why can't we get, full metabolic panels that really tell us what's going on? And she was explaining about, going back to being retrained, when you order too many tests.
Mm. I think that's definitely one aspect, is that you you then are monitored by the government in terms of you have to fall within the certain bell curve for your test ordering. And if you're at the extremes of the test ordering, you get slapped a nasty letter. And I've had these. And if you order a thyroid function test with a B12 and an iron studies, so very common for particularly female GPs who are seeing a lot of tired patients to order that panel, you you get these letters saying that you're requesting things outside the curve, and that then makes you feel quite fearful of doing it. And we've all had them for vitamin D requests that we've made as well. So that's one aspect. The other aspect, and this is something I've learned from going into the research very deeply, is that different different studies and different trials are done on different populations of patients. So some will be done on Chinese patients or Indian patients, etc. And then they're all looking at a different single condition. And so what they come up with as reference ranges for that condition in that population may not apply to other populations. And so it's actually very hard to get a clear cut answer, even in the research, looking at it very deeply. And if there's no guidelines on metabolic health, then you're sort of going by what you've been told or what you've learned or ascertained. And so that's another challenge with interpreting blood tests, is that the lab report will provide the lab reference range, but the lab reference range often reflects averages. And therefore, as the population has gotten sicker over time, they've just shifted the reference ranges to match the average, but actually that's now the average for sick people. And if you want health, you're outside of those reference ranges, and it doesn't flag in red when you're looking at pathology unless you're looking at them very specifically. And so they're the other traps and points that you've got to be aware of, and it's hard to learn that unless you're directly taught it. Yeah.
Yeah, I mean, we could spend all day talking about interpreting blood tests and the challenges and the benefits.
Yes.
But that is just another challenge that I know GPs face, and certainly GPs in Australia and New Zealand really face, which does make things a little bit more challenging for them.
I think there's a couple of opportunities though that you can sort of take advantage of with that, and that's the fact that it's one of those things that once you see it, you just can't unsee it. So it's one of the things, like, I think a lot of doctors in the space got into it because they either saw a patient who really got better on this sort of diet and looked into it a little bit, or they tried it on themselves. That's probably the more common thing, is they tried it on themselves and it worked, and then they could see it sort of happening everywhere. And so it's such a very reliable intervention, I find. If you've got someone with any sort of metabolic dysfunction and you prescribe a low carbohydrate diet or fasting interventions and they follow them, they generally get better. And that's very rewarding professionally, because a lot of the time in general practice, people are just getting sicker, which is somewhat demoralizing when I'm sure many doctors like me became a doctor to help people.
Yeah. I think that's something that we need to keep in mind, is that doctors really do want to help people. That's why they became doctors.
Yes.
Why is it, do you think, that there is such resistance amongst still a lot of medical professionals about low carb, introducing low carb into their patients' kind of prescription, really?
Yes. I think part of it is, I think there's many reasons. One reason is that the standard nutritional advice is to have 45 to 60% of your diets be carbohydrate. So it's a very big change from that. And that's very unfortunate because out of the three macronutrients, carbs, fat, and protein, only fat and protein are actually essential to the body. Your body can make all the carbs it needs by itself. So that's been unfortunate advice. And the other reason that they can be so resistant is I think there's a bit of confusion between what is ketoacidosis and what is nutritional ketosis. And so ketoacidosis might occur in patients with type 1 diabetes, or in some other groups sometimes, where their blood becomes acidic and their ketones go up and they become very, very unwell. And they don't understand that our bodies are made for fuel flexibility, that we're meant to sometimes run on fat and protein or carbs. Like we can switch between them all. It's just that we've burnt out our systems by running only on carbs. So I think that's part of the confusion. And if you take carbs out of the diet when people have been told to eat lots of carbs, well, now what do they eat? We're so used to, for the you know, last decades, eating carbs and having the carbs on the plate, that to think, well, what for lunch do I eat if I don't have my sandwich? What do I have for breakfast if I don't have my wheat bix? It seems such an impossible thing to do. And then I think there's also a lot of doctors who, like patients, are food addicted. So food and carbs and other nice treats have been used to soothe ourselves and to comfort us. And they're part of celebrations and things like this as well. And so the thought of taking them away can make people quite sad. And also, they need to know how to navigate those sorts of celebrations, Christmas, Easter, birthdays, Mother's Day, often involve chocolate. So, yeah.
And I think, there's a bit of an element of teaching people that you don't have to be perfect. Like we're not aiming for perfection. We're aiming for being good enough to manage our weight and control our blood sugars and our insulin and reduce the risk of those other kind of chronic diseases that come along.
Yeah.
So you're allowed to enjoy some treats at Christmas or on a birthday.
Yeah, I think it depends though. If someone is truly food addicted, if they derail completely, if they have a little bit, they can't stop thinking about having more, then it's a little bit like if someone is an alcoholic, we wouldn't say, well, you can just have a little bit. You would, it's something that they're best avoided. And so I've got quite a lot of patients. Food addiction is very common actually. And I've currently got a food addiction handout that's available for free on my website for health practitioners to use with their patients. They can go to my site. So, so I think, and the other thing is, I think it's changing the mindset to what are these celebrations about? Well, they're about spending time with family and friends, about looking at the great year that you've had, or other things like that. And they're the things that we remember. And you can certainly celebrate and enjoy all of those things without having to eat sweet things. And there's still so many foods that you can eat. I actually eat much better food now and a much more variety than I used to eat when I was sort of monitoring what I was eating and trying to keep things controlled, mainly because I had such high insulin levels probably that I was, so prone to gaining weight. Yeah.
I think that was really well said. And I know a lot of my listeners do contact me and say that they do think that they are actually sugar addicts rather than just sort of overeaters. And so anyone listening to this, Bish and Johnson, and I had a really great podcast with her and a couple, and Tia and Annika, a couple of other people who work in that sugar addiction area. So and like Louise just said, you've got to treat that very differently than from sort of general overeating without addiction.
Yes, definitely. Like it's definitely very treatable, and it's possible to put it into remission, but it's not possible to cure it. Those the wiring in your brain has been present there, and it's been on those circuits such that those food addiction circuits have been there, from a very early age, because people are exposed to sugar as very early on in life, and it's often what we call the gateway drug. It's the first thing they get exposed to, and they might have a increased response of pleasure to that substance when they first ingest it, but then they need to have increasing amounts of it to have that same response, and then they have trouble giving it up. They have withdrawal symptoms and different things like this. So they need help from their doctor, but also from psychologists who are specialised in food addiction, or at least in addiction, and then support groups and Facebook groups. There's books and different community forums that can be helpful as well. Yeah.
Can you talk about, and this is for, sort of the listeners who hopefully will include some of the GPs that you're looking at supporting. Can you talk about what you see in your patients, the benefits, like what gets resolved for them when they embrace a lower carbohydrate lifestyle?
Sure. Look, it's so great. It's the best. It's just the best part of the job, actually, is seeing people improve from these. I guess it's a little bit of a time investment initially to discuss these things with these patients, but they come back and they feel so much better. So usually the first thing that they'll say is that the they just don't feel so foggy in the brain. They have got more energy, and they just look happier. Their eyes are brighter, and they lose weight usually, and their waist circumference comes down, their blood pressure improves, and then their blood profiles improve. So their triglycerides come down, their HDL levels go up, their blood sugar comes down, their insulin levels come down, their fatty liver goes away. So all of these changes happen. And some people who may be having irregular periods because they've got polycystic ovarian syndrome, which is also a symptom of insulin resistance, their fertility might return and they might fall pregnant. So all these great things can happen. And I really like picking people up at if they're exhibiting any features of metabolic syndrome. So if they've got blood pressure that's going up, or blood sugar going up, or their waist is getting bigger, or their bloods are going out, I try to pick them up at that point, and I find that's very reversible. And even if they have diabetes, again, a lot of that is reversible or much more improvable. And I had a patient who came in and she was 79, and I'd seen her maybe 3 or 4 times over 6 months. And the first time she came in, she was in all this pain with sciatica pain. She has had diabetes. She was eating a lot of licorice. And after that, the last time I brought her in, I said, "How are you going?" And she says, "I'm wonderful." And she's like, "I don't have any pain." And she'd reversed her diabetes. And I just thought, wow, that's not very often that you see someone at the age of 79 help get so much better. Um, you just certainly don't see it with drugs, that's for sure.
Yeah. Drugs are really masking the symptoms, aren't they?
Yeah.
They're not really making us better at the root cause of the problem.
And some people still definitely need their drugs. Like sometimes people, I think this is an error of thinking of some patients, is that they think that they can get off all the drugs, and that this diet is going to be a magic pill that's going to, or magic fix for all of their conditions. But you can only reverse things so far. If there's been a fair bit of damage done already, it may not be able to reverse that fully. And some people, no matter how much they follow the diet, or even if they went extremely low carb, became a carnivore or something, like, they can still have their health conditions, and their medications can be useful for certain things, but certain medications are very unhelpful.
Yeah. Excellent. Oh, excuse me. If someone wanted to talk to their doctor about it, about this, how do you suggest they go about approaching their GP?
Sure. So I think, firstly, it's important to recognise that this is actually in guidelines. It's just not commonly known to guidelines. So the American Diabetes Association wrote a whole book about using very low carbohydrate diets in patients. It's part of the Australian National Diabetes Strategy for 2021 to 2030, where low carbohydrate diets are listed as one of the 3 ways to reverse diabetes, along with stomach surgery. And shakes and meal replacements, and those two are a bit more drastic or also not particularly sustainable. And it's even been in Diabetes Australia's position statement since 2018. So I think it is in guidelines. So, but if I was a patient going to see just a GP about it, is it, I guess I would probably just say, look, I'm interested in going on a low carbohydrate diet, that I have heard that they can really, reverse diabetes. And, there's like Diet Doctor or Defeat Diabetes websites, have these programs. And, I hope you can, I was hoping you could support me in that. I don't know, something like that, I guess. I think pretty much most GPs, the other way they could say is, look, I'm thinking of, this is how I reckon, this is how I think people should speak to their cardiologist about it. I think it's the specialists. I think certain specialties like kidney specialists are on board with it now. A lot of endocrinologists are coming on board, but cardiologists are still not on board. So with cardiologists, I recommend patients say things like, look, I want to cut out a lot of junk food out of my diet. I want to eat less stuff out of packets. I want to lose weight and have more energy, and I'm going to eat more fish, and I'm going to eat more protein and more vegetables, and I'm just going to eat less sugar. And there's no doctor's going to say no to any of that, because that's basically what a Mediterranean diet is. And a Mediterranean diet is a version of a low carb diet, not quite low enough for some people. So I think I would couch it in terms of that. And if you I don't know, I guess I'm in a space now where I work with doctors because I've exposed them to this, that I think anyone who came to our clinic and saw one of our 20 doctors would be encouraged to follow a low carb or keto doctor, encouraged to come and see me. So it would depend on them. But if you didn't get help from your doctor, I would recommend that you seek help from a doctor who is knowledgeable about it. And in Australia, we've got the Low Carb Down Under website, where patients can look up practitioners who are specialized in this. And I don't think you have to just give up your GP. It's just that they don't know about this diet yet. So the problem will come is when you have a blood test done, and if your cholesterol has gone up, which can happen, even though the other helpful metrics are improving, cholesterol doesn't correlate very well with coronary artery disease anyway, then the doctor may get alarmed about being on a keto diet. And that's the problem that happens, is that doctors may not know how to interpret the blood results, and so their reaction would be, well, this diet's going to kill you.
Yeah. And that's something I see a lot with my clients. Their GPs say, oh, you're off your blood pressure medications, you've lost weight, all those things that you just talked about. Their brain fog has cleared out. They've got a ton more energy, but oh no, your cholesterol has gone up. Triglycerides are nice and low.
Yes.
And I think this is, you were telling me you've got another aspect to your course that you're releasing in about a month. And so this is going to be part of the course for the GPs.
That's right. Yeah. So the first course that you mentioned before is the Low Carb Doctor's Kit, and that course is designed to make the prescription of low carb diets and fasting interventions with patients as easy as possible. And it basically consists of the patient images as well as the handouts, and there's a patient demonstration as well. And I've had doctors who have had no low carb experience who have bought one of those kits, taken it and run with it, and now have a special niche in low carb medicine. And I've had a cardiologist in America who's been using it, and even experienced low carb GPs in Australia have been finding it really helpful. So as well as the new ones, the doctors who are new to it, and also dietitians and acupuncturists and things like that as well. In terms of with the new course, which is Low Carb in a Nutshell, it is designed to really teach doctors about the fundamentals of lipids, about the macronutrients, diabetes, pre-diabetes, all those sorts of things, as well as a lot of case studies to teach them how to interpret the pathology, and also how to navigate guidelines and how to navigate colleagues who are disbelieving. So all of those things have to be part of the course, and I'm really looking forward to releasing it, because I think if you can understand how to interpret the pathology. And it's really easy, actually. There's not that much that you need to look at, but you need to consciously look at it in the blood results, and it fits so well with what the patient is doing. So if the patient is following a diet that is imperfect, their bloods aren't going to be improving as much as someone who's following it perfectly, for instance. Or if you see a metric start to go up, usually they've deviated from the diet, and it's worth calling them back to have a little chat about that and to see if there's anything that they can do to get back on track, etc. So that's pretty much where that course is at. And so the wait list for that, it's open, but it will be released 13th of October, or possibly even earlier. I'm just putting the finishing touches on the case studies.
Excellent. Well, if it's of the same standard, and I'm sure it will be, as the low carb doctor's kit, is that
Yes, that's right. Yes,
yeah,
that's
yeah.
right.
I thought that was excellent. I've been working in this space since 1998.
Wow, that's amazing. Yeah.
Yeah, I first came across it. I was doing some training with the Australian Heart Foundation, actually.
Yes.
The diabetes educator started talking about insulin, and I was in the middle of doing my master's degree, and I mean we knew about insulin from a diabetes perspective, but I had no idea. And it's the light bulb. That was my light bulb moment when I came home, and like, how come we're not talking about this?
I know, that's right. It's such a crazy thing, isn't it? I mean, it's what's in the physiology textbooks, actually. It's what we learnt at medical school in terms of that carbs put your sugar up the most. And yet we tell patients who are very carbohydrate intolerant to eat mostly carbs. It just makes no logical sense at all. And it's just the influence of pharma and big food, I think. Sadly.
Well, so I had a good look at what you sent me, and I really highly recommend it. I think I love the simplicity. I love your videos. You're so delightful and enthusiastic. You explain things in such a clear way, and I think all the handouts are amazing. So I just think, for anybody listening to this, if you think that it's something that your GP might be useful for your GP, I really encourage you to share this video. And Louise, will you tell us where people can find you as well? And we'll put it in the show notes.
Yes, definitely. So my website is www.lowcarbscripts.com, and I practice and so that's where health professionals, anyone who's a health professional, be it they a nurse or a diabetes educator or a doctor, etc., can buy any of my programs. And I also teach doctors how to run on time. So I teach them about time management strategies, and I also teach them how to reduce burnout, because I think those are important things for doctors to know. And because I've observed a lot of doctors in one of my other roles with the College of GPs, where I sit in and observe doctors and teach them about bedside manner and consulting skills, I've seen, how to improve those areas. And then I consult with patients at the Albany Hills Radius Medical Centre at Albany Creek. So if anyone's got any metabolic health conditions or other health conditions and they would like to see a GP who understands those things, and they're welcome to book in with me through any of the normal channels, which is usually via online or phoning reception, etc. And then the initial appointment has to be face to face. And I only see patients in Australia because medically legally that's all I'm allowed to see.
Excellent. Is there anything else you would like to share? Have you got any final thoughts that you'd like to talk about?
Sure. I guess probably the only thing is that what we're recommending is just so simple. We're just recommending people eat real food, less food out of packets, eat less carbs, prioritize protein, eat less often, and add a little bit of salt. And that's pretty much the essence of the advice that can be given. And even if doctors just recommend patients to, or encourage them to just eat real food, I think that people's health could improve so much.
I agree. And, we are seeing such a health crisis throughout the world. And, Australia and New Zealand, we're particularly bad over here, particularly with our childhood diabetes rates. That really worries me, and the obesity rates, which really worry me. And then we have this really failing, struggling health system that just cannot keep up with picking up what's happening at the other end.
It's such a tragedy. And in America, something like only 20% of their population is metabolically healthy, so the other 80% is unhealthy. And I think that's pretty much
Around the
everywhere,
world.
really. And with children and adolescents, they're definitely becoming metabolically unhealthy and developing fatty liver and pre-diabetes. And I was recently asked to give a talk to the University of Queensland's doctors who work at the health centre there, because they're seeing more and more university students with diabetes, which is just so awful that these people should be in the prime of their life, and that we have a health system that spends all this money on building hospitals and spending money on drugs when no one is really looking at, well, why are these people sick? Why is it that in the 1970s, when I was born, my mum could spend 10 days in hospital after each of her 6 normal deliveries of children, get established on breastfeeding, and recover in hospital, and now I can't even get a patient who is desperately sick in hospital for like a night. They ramped in with emergency for hours and hours and hours. So there's something very wrong that in single generations that our health system has changed in this way, and that the solution could be so simple.
And so obvious as well.
So obvious. So obvious. Yeah. As if someone told me it's a no-brainer. And it really is. It really is.
Well, I think one of the struggles is the challenge between knowing what we should do and being able to do what we know we should do. And I do think that if we can get some alignment between all the different health authorities, between GPs, specialists, all the nutritionists and dietitians and health coaches, if we can get some alignment that this is the way to eat, and we're going to have to make the choice to give up those processed foods ourselves. And, I saw something come out the other day where our government is talking about bringing in legislation to reduce the amount of sugar in some of the processed foods, which is great, but it's not enough, and it's too late, and it's more than just the sugar. It's all those other ingredients, and it's all the vegetable oils, and it's still not, and people still aren't stopping eating them.
No.
So I think we need to, if we could get an alignment between everybody and then start re-educating, that whole low fat phase was based on myth and misguided, very, very misguided. And it's certainly sugar, but it's actually even a bit more than that. It's all those highly processed foods that we fill up our supermarket shelves. We just need to walk past them and say no thanks.
I think so. I think even just walking and just sticking to the outside of the supermarket, the perimeter of the supermarket, avoiding the aisles, means that you'll avoid a lot of that stuff, which probably actually isn't even food. If it's got more than 5 ingredients and it comes out of a packet, it's probably not actually food. It's ultra processed. And I think I do think, though, that as much as it will be wonderful if guidelines changed in terms of the dietary guidelines, because that influences what our children eat in schools and
in hospitals
and all of that sort of stuff. I think that there's a lot to be gained with working with patients on an individual level and then also training doctors on an individual level. And you don't, and other health professionals, I've had a lot of patients who've benefited from seeing a naturopath or a chiropractor even who's told them about these diets. And these are people who've come to see me specifically for advice on their blood work, but already doing the diet. And so I think that by training a doctor or a health professional in it, you are helping so many more people because you're affecting the trajectory a little bit more. And I am not interested really in teaching people who are completely disbelieving and completely negative. I'm aiming for the low-hanging fruit. I'm aiming for people who are a little bit interested or slightly curious, or, I know that everyone can change their mind, they can, but I think there's so many low-hanging fruit.
And I can just see so much benefit in having GPs even acknowledge that this could be a useful strategy, even if they don't prescribe it themselves, because, I mean, I'm sure you can imagine that, over my career, it has been a real uphill battle, and it's only been the last, sort of 5 to 7 years, really, that this is really starting to become mainstream. And, without the support of doctors, people they go, I don't know what to do. I don't know whether to listen to you or listen to my GP who tells me that's crazy and that's dangerous. And look, your cholesterol has gone up. And
totally. I think people do listen to their doctors, and they listen to their cardiologist even more so sometimes. And they do feel confused, and they want to do the right thing as well. And they often want to please people too. And so all of that things make it very hard for them. And so if they can find someone who does at least not dissuade them, I think that's really, really important. And it sounds like you were part of the very early adopters of this, and there was this massive chasm before now the later adopters and the early, the majority are starting to adopt it. But I really think that we're very close to having more and more people on board, because the evidence has just mounted so much, and there's so many people doing it now. Keto diets is one of the most searched diets on Google, and so more and more people are doing it, and there's more and more programs out there, which is wonderful. So I think it's just going to be a matter of time, really, and it's just teaching people how to navigate the system, that it's big food and all that sort of stuff as well, I think is where they need to be aware of, and be aware of food addiction, so they don't get drawn back in sometimes.
Well, I love your work, and it's such a pleasure to be able to share your work. And like you say, there is, I think we're starting to flip the switch, really. We're starting to move into where there's so many more people and so much more understanding. And, it's a real pleasure to be able to share those people with the world, and share those people with my fellow Kiwis, because all I really want is to see the health of New Zealanders improve. We can do it, and the health of everybody everywhere else improve, Yeah.
Definitely. Thank you so much for having me on to talk about my programs and to talk about my views on this. And I really really enjoyed chatting with you today, Susan.
Yeah, well, I've really enjoyed it as well. And I'd love to have you back again sometimes.
Yeah, love to.
Yeah, thank you very much. Okay. And we'll make sure that we get all your contact details out there for people. And so to everybody listening, the take-home message is, please talk about this with your GP. Please share this with your GP. Please let them know that Louise is out there, and she's given you some excellent ways of actually broaching the subject with your GP about your own health as well.
Very good. Thank you.
Thank you.